Hey there, it's Preeti. Welcome back to my channel. Today we are going to talk about ethical principles in nursing. This is a very common topic that comes under fundamental of nursing. So let's look at the 7 ethical principles you need to know. The first one is autonomy, and this is respecting a patient's value and beliefs. A patient has the right to choice and self-determination. It's the idea that a patient holds the right to make their own healthcare decisions and has the right to make all choices in their care. Remember, autonomy think all by myself, like I make my own decisions. For example, it would be a patient refusing treatment because every patient has the legal right to refuse a medical or surgical procedure or any treatment if they are deemed medically stable. In other words, they have autonomy over themselves and their healthcare choices. Then the next one is beneficence. This is always doing good for the patient and acting with compassion. The nurse should always choose the good for each patient. You can remember this because beneficence look like benefit and it means good. An example of this would be by holding a patient's hand who is on hospice care and wants someone who is close to them. Then the next one is fidelity. This is where the nurse will remain loyal and faithful in their actions and care. They are keeping their promises and providing safe, well intentioned care. You can remember this like fidelity think faithful. An example of fidelity and healthcare would be telling your elderly patient you will bring them to the bathroom in 15 minutes and you act faithfully to your patient's statement. You are not just saying things to leave the room. Again, fidelity is being loyal and faithful in your actions. Then, next one is the accountability. That is, the nurse will take responsibility for all their actions. They are accountable for their errors or mistakes. You can remember like this accountability means I am accountable for my choices. An example would be when a nurse does a medication error, they are going to take responsibility for it and not try to hide it. Then the next one is justice. Just means fair and justice means equal care will be delivered to all patients. For example, caring for each patient regardless of their background, socioeconomic status, gender, ethnicity or history. Lastly, equal care will be delivered to all. Then the next ethical principle that is non-maleficence. Another way to say this, do no harm. The nurse should not inflict any harm on any patient. This could include intentional or unintentional harm. You can remember this by non means none and mal means bad. In other words, do no bad or do no harm. Example, when a nurse stops administering a medication that is known to be harmful. Another example is not administering aspirin to a patient with a known allergy to aspirin. Then, that is why, as a nurse, we should do multiple checks before administering to avoid a medication error that could harm your patient. Again, this is intentional or unintentional harm. Then, the next ethical principle is veracity. This is being entirely honest with the patient at all times. We can remember this veracity means very honest. Example is simply not lying to your patients. If a patient is taking a medication with a known adverse side effect and the patient asks, does this medication have side effects? You, as a nurse, must be very honest and tell the patient the known side effects. So here we end with our today topic that is 7 ethical principles in nursing. We all must know. So friends, if you find this video informative, so do not forget to like, share and comment. And to get notified for more upcoming content, do subscribe my channel. Thank you for watching. I'm feeling pink, blue, that's new. Riding around my head, I cannot think straight. That's strange. I wish you were here so you could stay forever.